go over is in this column where it says, what should I expect as abnormal and when to give us a call. So the first item, if your catheter is not draining urine, please contact us to let us know. However, there are two things to think through that are very common reasons why you wouldn't be draining urine, and they want to make sure that you're aware of those items so that you don't need to make that phone call. One item is that it's very common to get an airlock with your Foley catheter, and how an airlock can be created is, if you think about it, you have a bladder, which is basically like a bag, and then you have a Foley catheter, which is just basically a tube, and then a Foley bag, which your urine is going to be going down into. If your Foley bag builds up urine, where does all that pressure go? The pressure goes back to your bladder, and sometimes, because there's no vent in the system, it can create an airlock and nothing flows. So, easy way to resolve an airlock is you just empty your Foley bag whenever it's a halfway, 3/4 full, so to prevent yourself from getting one, as well as the act of just trying to empty your bag will ventilate the system, and you'll the airlock will be dissipated. So that's one item you need to be aware of that could cause your urine not to drain through your Foley bag. The second item that you should be aware of that you need to be mindful of if you don't have any urine come through your bag is, are you dehydrated? Do you need to drink more fluids? So if you don't have any urine coming through your bag, drink some fluids and see what happens. Usually it might be a bit of dehydration, and you'll have that urine come right back. So if you do not see any urine coming through your catheter, before getting alarmed, empty your Foley bag, make sure you don't have an airlock, and drink your fluids. And if those two items don't really resolve the problem, and you're still having questions why your urine's not draining through your bag, please call us. And you'll be calling our urology practice number that's 24 hours, 7 days a week for urgent matters, which is 415-353-7171. The other items to go over is if you have persistent cloudy sediment-like urine that also smells a bit bad or foul smelling, that's a good time to give us a call as well. So the key word in that sentence, though, is it's persistent. So as I mentioned a little while ago, if your urine has some sediment in it, that's normal as long as it's very brief or intermittent amount of sediment. I mean, you drink fluids and it clears. However, if the cloudiness is constant, doesn't go away after drinking lots of fluids, you should give us a call, because then what we're thinking is you may possibly having a urinary tract infection that would need to be worked up. Another item that we should talk about is the urine color and consistency that we do not like seeing and that you should notify us on. As you remember what I talked to you about earlier, your urine's going to be water-like lemonade cranberry juice, perfectly fine. The color you call us about and consistency is if your urine looks like tomato soup. That's a problem. So if you ever get tomato soup like color or consistency of your urine, you need to give us a call. And again, when you're assessing your urine, you're looking at your urine through the catheter tubing. Now, last items that I want to make sure that you know, which is very, very important to know after surgery, as an abnormality that you should report, you would obviously always call us if you have the worst headache of your life, chest pain, shortness of breath, nausea or vomiting, excruciating abdominal pain you've never experienced before, as well as if you have swelling that's not equal. You know, I did tell you you're going to have a 5 to 20 pound weight gain, which you're likely going to see your hands or your feet being swollen, but they should always be equally swollen. So not one arm versus another arm is bigger, or one leg versus another leg is bigger. You should always call us if you notice something like that. As well as if you have ever any pain in your arms or in your legs. And so those are all the items I wanted to go over with you. I hope that this review has helped you. And as always, you can go through the materials that you were given in clinic as well as inpatient to be sure that you got these items down.